Hello, welcome back to Sextras.
Where we talk about sex and all the extras.
I'm Honey,
And I'm Maria.
and welcome back to our Pleasure and Desire mini-series. We've got so many good guests in this mini-series.
I know, so many good episodes, so much shit that we're learning.
Yeah, and this episode we're joined by Dr Marashi Avail. He's a gynecologist, and he created the first ever physician-backed anatomically aligned vibrator, which is cool. It's kind of crazy that hasn't happened already.
Yeah,
But
I know.
yeah, he's innovating the industry. He's also a labia consultant.
We learned so much about the clitoris. We talked a lot about that.
Yeah.
We talked about the reasons for the pleasure gap, a lot about female anatomy and how to use that to improve female pleasure and to close that gap. So it's a great episode to, learn a lot about yourself and a lot about the capabilities and just shit that we should all know.
Yeah, and obviously he's a practicing physician. So he knows a lot of the actual medical background to all of these things. We talk about a lot of the social issues in terms of the pleasure gap, and obviously we complain about that a lot, but it's really good to hear from a medical background, this is why this is happening, and maybe it's partly to do with not knowing the anatomy and partly not to do with how much we talk about it and stuff.
100%.
So yeah, it was really helpful, and we hope you guys enjoy the episode.
Yeah, and definitely join our Patreon if you want to watch. I mean, I'm sure we'll have clips of it, but this is really worth watching because he pulls out a lot of props and what are they called? A 3D diagram.
Models of
models,
vulva. So you can see how everything he's explaining to do with the clitoris and anatomy works in real time. It was really a fun phone call to be on. You guys can see our reactions over on our Patreon. Plus there's also loads of other benefits. You get a free sticker, you get planning voice memos, we'll do bonus episodes.
Yeah, as well as more of a two-way street of what you want to hear. And yeah, we definitely want to feel more involved with our listeners. So that's a great place to go if you want to be more involved too.
It's just £3.50 a month as well. So very, very minimal effort. But yeah, a massive thank you to Dr Marashi for joining. We hope you guys really enjoyed the episode.
Yeah, let's get into it.
Okay, thank you so much for joining us. Could you start by telling us a little bit about your current job role, who you are, what you do, what that involves?
Well, thank you so much for having me, and good afternoon to you. I guess good evening to you guys, right?
Evening.
Yeah, so I'm a physician. I'm a cosmetic gynecologist right now. I'm running multiple practices, basically, and teaching cosmetic gynecology to other doctors, trying to make labioplasties, vaginoplasties, all of those much safer and kind of changing the game that's been done for a very long time without too much attention to it. At the same time, as I was doing these, I started learning female anatomy a lot more than was taught to us in medical school or anywhere else. So we started a line of female pleasure, which is called Sere, as ceremony of self. So those are all toys and gels and everything that's anatomic and really goes with the physiology of your body. So I'm the founder and CEO of that company as well.
Okay, great. And how did you said that you started learning more about female anatomy. What kind of got you interested in that area?
Right. So my background is I come from Iran. So I grew up in Iran. I went to medical school back in Iran. And I started things very early. Since I was 4 years old, I was following my father in the operating room back there. And I kind of saw the culture and everything that was happening. In med school, I started super early. I was 15, 16 years old when I went to med school. And back then, women were prosecuted for not being virgins on day of, getting married. Sometimes the family of the husband would take them to basically get tested to make sure they are a virgin and all of those. So that kind of got me into that field. I started learning how to repair hymens. And believe it or not, just people said, well, you are lying to guys. I'm like, well, guys are lying to women. They want to do whatever they want to do. And then when they want to get married, they want to be with somebody who's never seen the light of the day. So they deserve to be lied to. And I really didn't do it for that reason. I did it because, these women could have gotten killed on the night of their wedding. And it's not just, sometimes they were with their boyfriend. So the boyfriend already had sex with them. He knows that they are not a virgin. But the boyfriend's mother, the fiance's mother, the day before getting married, is like, okay, I got to take you to the doctor to check you to make sure my son is getting married to the right person. So it was super, super unfortunate. So, but that's when I got basically my head start to do surgeries on vaginas, hymen, intricate surgeries, because you want to fix this the way that a gynecologist doesn't realize that this is done. So it wasn't just putting a couple of stitches. So that was the beginning. And then, of course, in the US, I started doing a lot of nonprofit work helping female genital mutilation victims. So these people are, they've gone through so much at the age of 5, 6. They cut their clitoris, and they are scarred for the rest of their lives. They turn them into a baby making factory. But at the end of the day, it's not just that. Now they are scarred. They go through therapy. Whatever happens, they have like 5, 6 kids. They don't ever enjoy sex. That's the problem, and I think that's a sin, because the man is enjoying the sex and you are not enjoying the sex, and he just does whatever he wants to do. So I started working on them, and that really got me into anatomy of clitoris. As you know, we don't really teach clitoral anatomy. At least for the past 100 years, it wasn't being taught in medical schools, which is very sad. In anatomy books, it was completely censored since Dr. Freud came out and said, you know what, any orgasms that happen from clitoris, it's an immature orgasm. And the only mature orgasms are the ones that happening with penetration. So a penis has to be involved. And so basically more power to men and less power to women. So if the man can't make you come, and you're masturbating, it means that you're getting immature orgasms. So Gray's Anatomy completely eliminated anatomy of clitoris from it. And to us, when we went to medical school, oh, what's the clitoris? Clitoris is a small prominence, a pea-sized prominence that is located where the two labias meet on top. But that's not the thing. Clitoris goes a lot deeper. Clitoris is a much bigger organ. And as you see, one of the toys that I designed, it's a tribute to anatomy of clitoris. So this is the only thing that we see from outside. This is really the glance of the clitoris. And that's all, these idiots that do female genital mutilation and cutting, they basically cut this part and put a couple of stitches. They don't know there's so much deeper. Clitoris is almost as big as a penis, you're just packing it inside. And when it gets engorged, the entire area gets engorged, the woman gets a lot more sensation and feeling. There's a huge nerve, dorsal clitoral nerve there, that has over 10,000, nerve branches. This is huge. And, for men, erectile dysfunction has been the biggest deal. Viagra didn't take that long to get approved. But I feel like COVID vaccine took longer than Viagra to get approved. It's such a sad thing, and because erections are an emergency, that. So
Of
it
course.
is super, super unfortunate. And I thought that I could be the voice here, because honestly, when I left Iran, when I came from there, I thought that, oh, I left that culture and everything behind me, and it doesn't exist here. I lived in England for a while. I was in Sheffield, and then I came to US. And funny thing is that I always thought, I'm like, my dad dealt with my sister differently than he dealt with me. Oh, she has to be home at like 5 p.m. She can't have a boyfriend. She can't this, she can't do that. So I'm like backing around. I'm like, oh, God is a man. God is a man. But I came to US and England. I didn't think that's the same. But I'm like, you know what? It's a little different. Yes, you don't have to put a headscarf on, but they will make you do other things and they would give privileges to men that they don't give to women. I mean, recently things are changing, but it's very unfortunate how we have that kind of bias towards, men and women, even in jobs, even like presidents, whatever, CEO of companies. Yes, we have more and more women right now, and I'm very happy for that. And I hope there's going to be a day that we have more women in charge because, you know, as much as women are emotional, when they want to decide about big things, they actually are very rational. Men think very differently, maybe business minded, this, that, but men is kind of like, the erections. As soon as the man got in and he came, okay, great. I'm not going to even put your clothes back on and I'm not going to help you out. I'm going to sleep. Doesn't matter you came or you didn't come. So that is the big difference. But a woman wants to sacrifice. She's in pain. Okay, let me make sure I satisfy him. Let me make sure he actually ejaculates. Let me actually, to boost his ego and make his head even bigger than what it is, act an orgasm. Let me fake it. And that's a mistake. Women shouldn't have been doing that for many, many years, but they did. So when I came from Iran, I thought I left that behind, but it exists here and it's even bigger here. Back there is like very black and white. You know what? I see your hair, I'm gonna beat you up and I'm going to like literally put you in jail or I kill you, like this girl that they recently killed and all these people is black and white. Here, no. You know what? If you don't play by the book or don't do things that we want, we're gonna let you think you're doing it. But then they are gonna do something to you that you wouldn't even know that happened. And that's why they kept women behind for so many years. And in orgasms, it's super, super important because you know what, one orgasm is much better than being in the gym for 10 hours. Like literally, if you get a good orgasm, the amount of endorphins, which are the internal morphines, the amount of enkephalins, which are from the same family, serotonin, dopamine, it's so high that you can't get something like that with going to the gym. So never underestimate the power of an orgasm. And that's why it makes you into a better person. You feel much better. And it's so sad that we don't care about women's orgasm as much as men's orgasm, because guess what, if men had to fake orgasm and just don't come and don't get an erection, there would be a World War III right now. You would have been like, you wouldn't talk about breast cancer or anything else. That would be the first medication that they made, and that's why penis pumps go many, many years back. When was the first toy, sexual device made that looked like a penis? How many years ago, you think?
Like thousands.
You're close, yeah. How many thousands?
3,000.
You're good, times 10. 28,000. 28,000 years
Oh
ago,
my god.
they made toys that looked like penises. The big D. Oh, yeah, because it's big and nice and it's out. But in 2022, it's the first time we actually have a toy that looks like a clitoris. Why? Because second class citizens, we didn't care about clitoris. And that's why I have these sweaters that I put the picture of this on the back. I'm like, if you know, you know. And I ask people, I'm like, what is this? Honestly, out of 100 people, 99 people don't do it.
Wow.
When we did the design, and it's so funny, I did the mold designs and everything with my colleague, Dr. Lovey, and we send it to make the molds and all of those. The companies who were giving us quotes, they were referring to this as the bird toy because it looks like a bird to them. They didn't even know it's a bird toy. Somebody else said, I'm like, it's not a bird toy. It's like, oh, I thought it's a wishing bone. So I'm right. And he was fighting with the other people. You see, I told you it's a wishing bone. It's not a bird toy. It's so sad. Now put a penis out there. How many people are not going to know what that is? Even a 5-year-old kid knows. That is the problem. But I'm so glad and so thankful that there are people out there like you guys, you ladies. And that's why I take away from my time for surgeries, clinic, anything. Whenever there's a podcast about something like this, I want to make sure I make the time because we need to put the word out there. It's very important because if women are happy, come on, we all came out of a woman. And all men are working all their life to go back inside a woman. So if women are happy, the world is going to be a better place. And one part of happiness, it's physical happiness. And this is not just physical. Good orgasms give you a very good mental status and very good, state of psychological happiness. It's really a treatment to so many things. If you look into researches for orgasms, you have a headache. Guess what? Masturbate or have sex, have an orgasm. 90% chance the headache is going to go away. I think really orgasms are treatment to so many things. And regularly, if you give this to yourself, it's very good for your body and mind. And that's why we are in this field.
And why do you think women aren't having so many orgasms? Like, what are the main issues that are preventing women from having as many orgasms as men?
Well, one thing is women are more reserved. You are not as outspoken, the society has taught you. Our mothers have taught our sisters and women to be more kind of closed off. Why? Because you don't share. If you don't get an orgasm, you may feel bad and you may, not even say to your partner that you don't even tell your partner, this position I like, this position I don't like. But you have to start talking about that. What's the name of this area in anatomy? In Latin, they call it pudendal area. What's the meaning of pudendum? Pudenda, it comes from it is basically the area to be ashamed of.
Oh, wow.
That's why in Adam and Eve used to cover it with a leaf. So that's the reality, is the area to be ashamed of. But where is the shame about this area? It's actually, I think, the male part should be more shameful because it's like hanging out and it looks like, I don't know, elephant's trunk. This area actually looks good. It doesn't, yes, it is sexual, it's sensual, but there's nothing to be ashamed of. So that is one reason, and women don't talk too much about their problems. Guess what? I do two things. My focus of practice is one, cosmetic gynecology, which I do a lot of it. I do a lot of labiaplasties, treating botched labiaplasties, all of those. But the other part of my practice is endometriosis, pelvic pain. And I tell you, so many women come to me, and when I find that they have endo, oh, why didn't you tell your doctor? Why didn't you tell anyone? They're like, well, I was talking to my friends. I was telling to my mother. I was talking to my sister. They said that's normal. Everybody gets cramps, and it is not normal. Women are not into speaking up about something that's happening because, oh, it's normal. It's your period, I'm giving birth to a baby. Of course, I'm going to have pain until somebody says, you know what? It's not right to have pain. These many years is not right. So let's give them epidurals, and at some point that is started. So if it's about pain, they finally spoke up. But I think this is the time to speak up about orgasms because, you know, as much as this is good for men, it's good for women. And actually, an orgasm in a woman is much, much stronger than an orgasm in a man. So I think they should, I mean, everybody deserves one and more than one. So you have to talk about it. And you got to figure out why you're not getting them if you don't get them.
So do you think it's more about like the social aspect? Like, what do you think? Because I feel like there's a lot of misinformation about just female anatomy in general, and that's playing a part. So, like, could we talk a little bit about some of that misinformation and like genuinely the physical side of things? And like, there's a lot of
Of
misconceptions I
course.
feel that are stopping women from experiencing pleasure.
That is true, and that's, of course, that's lack of education, and that's because this hasn't been out
Mm,
there. As I said, so clitoris is the most, like, literally sacred organ that we have, and it's the only organ that has one basically duty, and the only duty is
mm,
pleasure. So, because you look at the penis, yes, you pee with your penis as well. So urination, is a part of that too. But this is just for pleasure. And we need to learn really what's happening with biomechanics of sex, what's happening with physiology of sex. And if women know that, then they start enjoying it more. For women, it is easier because if you didn't know the anatomy, even you would start touching yourself, you would see what would be more, you know, uh, basically stimulating. You would kind of figure out which parts are better, which parts are not. But I inject people with different things, let's say exosomes, sometimes stem cells, PRP, and all of those. And then we find some areas in the vagina, which is, I call it the G zone, which is in the anterior, I don't want to call it G spot, anterior wall of the vagina. And I'm like, oh, so how is this sensation in this area? And they're like, wow, I didn't even know something like that exists.
mm.
So you start injecting those, and you don't even need to get them injected. You just need to find them. You need to fix the angle. So one of the things that I talk to people a lot about is that it is all about the angle. And I want to explain that because if you get one thing out of this, you will know how to get a good orgasm. So this is a pelvis, right? So here is your vagina. So normally when you enter, so this is the back, this is the front, right? So this is somebody who's laying in front of you, legs are open, right? And you're looking at the vagina. So what happens normally, the angle of the vagina when you enter is a downward angle. So it goes down. So
Okay.
let's look on this to have more perspective. So this is the front, again, same angle. I'm gonna turn it
Mm-hmm.
sideways. So if I'm entering the vagina and the vagina has normal anatomy, it's like this. It goes downwards.
Okay.
Why does it go downwards? Because the front wall of the vagina is the most sensitive wall of the vagina. And what's the reason for that? Because you have the clitoris. So imagine this is the clitoris. I mean, the rest of it is under the skin.
Mm-hmm.
We don't see it, but this is, you see the tip of the clitoris because the clitoris is sitting on the front wall of the vagina. So when you have this angle that's going downwards, you really want to push up with the penis to stimulate the front wall of the vagina. So what does this mean? This is your downward angle. The penis is entering, or anything, any toy entering, it stimulates the front wall of the vagina because vagina is going down. And that's why a lot of penises are physiologically tilted up too. So you're stimulating the front wall of the vagina. Now, what happens when we age and we have kids? Slowly, this angle becomes flat. Okay, just like my face, I start losing fat here, losing collagen. It used to be like this. Now it's like this. You guys are young, so you don't even know about that point. But you are still like the plum. I'm the prune. So that's what I tell people. We all start like a plum. We end up becoming like a prune. So same thing happens to the vagina. The angle used to be like this. Now you lost all the tissue underneath. Now it's becoming flat. Now when you have intercourse, you're not having any friction or stimulation to the anterior wall, right? And that is the problem. The older we get, the more kids we have, all of those, the angle becomes flat. So a lot of people start being, oh, I don't enjoy sex as much as I used to enjoy it. And then, let's say, there are procedures you can do. There are so many things. I'm like, listen, it's all about the angle. Fix your angle. We did a research to see which sexual position is the most satisfying for women, you know. And how did we do that? We used ultrasound. There is a protocol I created with my colleague, Dr. Lovey, on clitoral ultrasound. We call it clitogram, like mammogram, but this is clitogram for clitoris. So with clitogram, we look at the clitoris and we can study it to see when it gets engorged, just like a penis when it gets hard. The penis, you can look at it and you see when it's big, when it's small. But for clitoris, you look with ultrasound and you see when it's like very juicy and filled with blood and basically is erected. So we did that protocol to see which sexual device works, which gel works, and what happens with intercourse, what position is the best for women. And guess what we found out? The best position for women that they get the most amount of stimulation in the clitoris is going to be, let's do a trivia. What do you think?
I think it's girl on top, like cowgirl.
Okay. I see you like cowgirl. Okay. What about you?
What do you think?
Doggy?
Okay. So, wow, very
What
off.
is it?
But
I don't know.
so I tell you one thing. Doggy is the best for men. They love doggy because, of course, they see the whole view and everything. For men, it's really, and we are all animals in our brain, so it's that's why doggy. A lot of people love it, but in reality, actually, doggy gives you the least amount of stimulation in the clitoris and the least amount of engorgement in the clitoris. Now, not everybody's the same, but that's about the doggy. About the reverse cowgirl, what you said, it's a good position because you are in charge. So you can really, whenever a woman is on top, you can change the angle. And as I said, it's all about the angle. So you can change the angle to make sure you get that friction. But let's say effortlessly, we did all of these. And the most amount of stimulation in the clitoris was actually missionary. You know, woman's legs are up, the
Oh,
angle is
yeah, that makes
downwards,
sense.
you're stimulating
Right.
here very nicely. And guess what? We found another position that you even get more stimulation in the clitoris, and clitoris becomes the whole thing, it becomes red and blue. It's just so juicy in that position and so engorged. And that was again missionary, but with the pillow under buttocks. Why?
Yes. I see
Because the
that.
angle was this. Now you put a pillow, now you push the angle and you make it even like this. So even if the guy is blind and he's the size of pinky, when he goes in, he's hitting that G zone all the time. So that was, I mean, at least in our study, we did clitogram before, during, and after, and forget about it. Missionary with pillow under the buttocks. The clitoris was huge, the size that you would see, the
I believe
engorgement,
that.
everything. So,
I see that.
Interesting. Like, why is this? I don't understand why this isn't taught in like sex education. Do you think?
well,
Oh,
we got to start doing it somewhere. Because nobody knew about it. We didn't even know about it.
mm,
Look, it's biomechanics of intercourse, basically. And biomechanics of intercourse was never studied. Biomechanics, people study it in like sports medicine. They do it for, let's say, knee injuries. They do it. They say, oh, when you are walking, your back pain, this, that. These are all biomechanics. The mechanics of living and walking and all of those. And those are the big ones because you want to put like a joint, like whatever, artificial joint for somebody. You want to know how it's going to react. But with sex, people think they know everything. First of all, it's an area that's closed. Nobody talks about it too much. But now this is the deal. We want to bring science back to the bedroom. And funny enough, the reason I was in Sheffield is that I was studying biomechanics back then. The biomechanics that we did, it was all on footballers. And I mean, if you have U.S. Listeners, I meant soccer players. But when I came here and I said footballers, people laughed. They're like, "You don't have football in England." I'm like, "Yes, we do have football in England." But so it was on footballers, and that was the most important area to do biomechanics. I'm like, well, why don't we talk about different forces and different angles in intercourse? Because it's very important.
and Obviously, this is something that's kind of like understood in the medical industry, or at least increasingly so, hopefully. How can we get that information across to like the wider population? Because as you're saying, people don't always talk about it. And like if women aren't talking about it, then how can we kind of spread this knowledge? Like, what do you think the best way is to do that?
I just think, look, it's growing up is already starting to spread, and things that you guys are doing, things that I'm doing, because it's actually not that known even in medical community. The problem is that uh, medical system, medical school is a very, for lack of a better word, very corrupt system. I tell you why. The things that they don't want to teach you in medical school, first, they don't teach you about prevention. Let's come out of sex completely. They don't tell you, oh, you know what, if you eat like this, if you, let's say, take your herbs, if you take your vitamins, if you exercise, none of these things. It's all about treatment, because treatment is what's making money for pharmaceuticals. That's what we care about. So that's fine. You have diabetes. I know the pill for it. You have high blood pressure. I got the pill for it. Guess what? You could have taught me something so I could have prevented that. That's number one. They don't teach you that part. And I feel like intercourse and sex, it's something that they don't need to teach anybody, to learn about it. First of all, it was never taught to us in medical school. So not too many people are studying these kind of things because of the taboo around it and everything. So don't wait for doctors to do this. I'm probably one in a million who is crazy enough to do something like this. And you got to do it yourself. And what you guys are doing, you ladies are just talking about it, coming out, like putting your time to uh, talk about sexuality, orgasms. That is really important, because your voice is much stronger than the medical community. Thank you so much for bringing me here, and I can talk about this. But at the end of the day, it's about people like you talking out there, and every listener out there needs to sit down and talk to their friends. Oh, do you know about this? Do you know about that? And we just need to increase the knowledge around this, because there are so many. Look, we have this concept that we are working on right now, and I think a lot of women that don't get orgasms, it may be an erectile dysfunction in the clitoris. So we actually studying with this clitogram and erectile dysfunction on women. If somebody told me about that 10 years ago, 20 years ago when I was in medical school, I'm like, these people are crazy.
Mm.
But right now I'm doing that to study myself. And a lot of people, it scared me. Look, I did the first designer vagina fashion show in New York City. That was in 2017. It got a lot of heat, but it got a lot of press. And I started seeing like basketball wives, housewives, actresses, they all flooded to the office after that. But the biggest reason I did that designer vagina fashion show, people say, oh my God, this is perverted, this is this, this is that. It wasn't about people being naked there. It was about taking the taboo away from the subject. It was about women coming there and talking about, look, after I did this, now I feel so comfortable. I can have the lights on, I can have him go down on me, and I actually enjoy my orgasms. I think that's something that we need to give the podium to women, to everyone, to start talking about it. And honestly, I think it's already started. I think the past 4 or 5 years, we've gone a very long way that we haven't gone in the past 100 years.
Mm.
Yeah.
Can we talk a little bit more about pain in women's like genitals, like clitoral and vaginal pain, and just like lower pelvic pain, and like how that's spoken about, how regular people go to their doctors about it, and then also how doctors kind of like inform their patients about how to deal with it, how that impacts their sexuality, if that impacts like clitoral engorgement. Yeah.
Right. So look, and there are so many reasons for that can happen. But the most important thing, you basically hit the nail on the head. You have to, as women, if you have this problem, you have to go to a physician and you have to talk about it, whatever kind of pain there is. Because a lot of times patients say, oh, you know what, it's normal, or they're ashamed to talk about it. So that's very important. And number two, a lot of times your GP, because I know you guys have GPs there, or your doctor, your specialist may just brush it away, brush it off, and be like, it's nothing, it's normal, don't worry, let me give you some like lotion, this, that. No. Do not take no for an answer, because there is no pain that is normal out there. That is very important. So if the first person says it's normal, go to the second person, get second, third, fourth opinion. So there are different reasons for having pain. Of course, pelvic pain, one of my biggest passion, of course, is endometriosis, but that's more internal pain. But it can also cause like pain with deep penetration. So a lot of times people don't want to have sex and they have endometriosis because they're like, well, when I have intercourse, I have pain. Same thing with any other area in the vagina or clitoris. If you have pain, of course, you tend to want to have less intercourse rather than wanting to fix it. Now, the problem with having less intercourse is that then you don't want to have sex anymore, because you're like, every time you're connecting that to, having pain. So it becomes like a car that you left it in garage and you were trying to whatever go out with it once, and you saw, oh, one of the tires is out. Instead of fixing the tire, you just leave it in the garage, leave it in the garage, leave it in the garage. So it's going to be the 2 tires, 3 tires, all 4 tires. After a while, this is just going to be this antique car that you're keeping it in the garage. So that's not the way you should have to deal with your vagina. Actually, even if there is pain, you got to use lubrication, you got to do things, you got to try to have sex. Now, there are sometimes that things become very difficult, because you may have irritation. Again, your doctor can tell you sometimes irritation could be due to an infection. So you got to find out what infection it is. The pH of vagina is very important. You don't want it to be too acidy or too alkaline. You want it to be on the acid side where it's supposed to be. So I tell people, don't use soaps around your vagina because it kills, the bacteria, you end up getting yeast infection. And so it is very important to be mindful of how you are dealing basically with your vulva, your vagina, and all of those. And I can come up with like 20 different things that would cause the pain. So every patient really needs to be seen to see, is it just a simple irritation? Or God forbid, as bad as, is there like a tumor or something there, is there, which is very rare, by the way. I don't want anybody to listen to that, to some be like, oh, I have pain, I have a tumor. No, probably in my whole practice, I saw it like twice or 3 times. So, but there are so many different reasons that you can have, because it's, remember, the nerves that are coming to the area, to the clitoral area, and your entire pelvic area, they start innervating all the way from your cervix down, and all of those other areas as well. So you may feel a pain, in your vagina that's not really from your vagina. At the bottom of your uterus, you may feel a pain that's really in the vagina. So you need to see the specialist. They need to figure out really, but get to the bottom of it. Don't leave it alone.
Mm-hmm. And what about like numbness and that kind of thing? Like, how will that be dealt with? And like, how can we talk about that better?
So numbness happens because sometimes it is iatrogenic, meaning that the doctor caused it. That I deal a lot with people who had like botched labioplasties, and now they have like numbness because they cut a nerve or something, and we try to help them. So that's one thing. That's why you have to really study who you are going to do these surgeries with if you want to do it. And again, before going to the second version, is that nobody really needs a labioplasty or cosmetic surgery down there. I want to put this out there. Everybody's vagina vulva looks nice. It's like some people have big nose, some people have big boobs, smaller breasts, larger breasts, all of those. It could all be, it is normal for your body. Cosmetic surgery is about wanting. So it's about, if you want it, is a different story. Sure, you can do whatever you want to do with your body, but make sure you do it in the right place with the right specialist, because you don't want to end up becoming botched, and then things are going to become so much more difficult to fix. So that's one reason you can get numbing there. The other reason that you can get some numbing there. Could be, again, irritation, could be, like, some people say, oh, I've always been numb. And I would tell them, probably, it's really not being numb, is lack of sensation. Because if you want to call it numb, like if you put a needle in there, you don't feel it, of course you would feel it. I mean, so you are numb. Do you mean like if you don't get aroused or stimulated if somebody touches that area?
Yeah.
Correct?
Yeah.
Okay. So remember, orgasms are much, much deeper in women than they are in men. In men, they see something, they see the hole, things get erected, and they can literally have sex with anything. In women, 85 to 90% of it happens in the brain. So, first thing is that you've got to make sure that connection is there with whatever person or object or video or something that you are, getting intimate with. So sometimes people who say, oh, I never had an orgasm, this, that, and they are telling me, oh, but I recently met this guy. He doesn't even touch my hand. Or I met this lady. I just see him and I get these butterflies. I feel like my entire area gets warmed on them. So a lot of it is in the brain too. So that is very important to make sure you have that kind of relationship, and you make sure you do like a lot of foreplay, even if that relationship foreplay is good because you start stimulating the clitoris. Listen, if the nerves don't get enough blood supply, they are not going to transmit too much of sensation. So you want to make sure you get it engorged. uh, don't know what I mean. If Imagine a guy and the penis is not erected and they are not into it, or something has happened, they don't even feel like that. Doesn't matter what you do with that penis, they're not feeling it. So you're trying to do the same thing with the clitoris, but you don't see the engorgement. And you are kind of trying to beat that horse. Nothing is going to happen. You got to make the horse alive first before you get to the next step. And that is why, a lot of these anatomic and physiologic things that we are doing, I don't know if I even have this here or not, but if I do, I'm going to show it to you. There is a gel that we designed, enchantment gel, which is actually just came out this week. It took me 5 years, to do the research on it. We gave it to different patients. My partner, Dr. Kim, actually tested it on herself. We looked with ultrasound. So we want to bring more blood supply to clitoris, and this is what it does. It makes clitoris engorge. It's a proprietary formulation, which is very unique, and we had to go a lot back and forth on it. It makes the clitoris engorge, so the sensations become a lot more. But again, at the same time, you want to have that connection as well. Because there's one thing that if you're using a masturbating yourself, but if you don't have that physical connection, or mental connection with somebody that you're having sex with, doesn't matter what you do, so many times things are going to be numb, you know.
Mm. Yeah. So how does
Serre, like ceremony, serre.
Sere, how does that work to increase female sexual pleasure?
So, well, we have different sexual devices, sex toys, which are we did like a lot of studies on them to make sure different aspects are correct. So let's say for like this is the mini one that I have. First of all, as you see, a lot of stuff that we have, they're mostly black.
Mm-hmm.
The reason they are black is that you see the smallest lint or dirt or even your discharge on it. A lot of women that come to my office, 70% of women come for yeast infection, bacterial vaginosis, all of those. So your toys need to be washed. So I wanted to go black because you know that things are clean. And look, super flexible. All of those, we use medical grade silicone. So we try to make a difference. My investors hate this because they're like, oh, you chose, like, as you go to a steakhouse and you choose the highest premium, like Wagyu beef. I chose that kind of silicone that could be used to, in surgeries even. well, if I'm putting my name on it, it has to be that kind of silicone. And then, so that's one thing. The black color being non-porous, these are very important. And then anatomically correct, like we have this spellbound stimulator, which is really amazing because it completely bends to the shape of your body. And you can stimulate from outside. You can do the suction on the clitoris, which is kind of like somebody's offering you oral sex. And the other side is all the way inside the vagina, sitting on top of, right underneath your G zone. So you are stimulating the inner portion and outer portion of the clitoris at the same time. Or, the gel that we have, the enchantment gel, you engorge. I recommend to everyone use it externally on the clitoris or even penis. I mean, I don't mind people using it on the penis. It works really well, but we made this mostly for women. But you use it on the clitoris, and like 2-3 minutes before you masturbate or you have sex, and you bring all that blood supply to clitoris, so that it's going to be a lot, more sensitive. So these are things that we are doing. We are coming out for Valentine's Day actually with a very, probably is the most powerful bullet out there, because I want people to have, and it's very discreet, have it on the go and use it. But basically, our goal is to empower women with good products that actually work and they are physiologically and anatomically correct, and basically increase these kind of conversation that we have between us, to basically take the taboo away from it. And it's all about a woman's right to pleasure.
Yeah, it's so important. It sounds great. I want to try
Yeah.
it.
Sure.
I wanted to ask, so just to confirm, female pleasure comes from the clitoris. Like, is there any pleasure that can be had from like the vagina essentially?
Yes. So that's the thing. You see, the clitoris that we are talking about is
Mm,
this part, just the tip of the clitoris. But really, the vaginal orgasm, when you are having it, is really from the clitoris, but from the
right.
internal part of the clitoris that you are not seeing it. So, what we used to call vaginal orgasm, I tell people, is really, another kind of clitoral orgasm. It's just the internal part of the clitoris.
Mm,
Now, there are other orgasms that we are working on. One is cervical orgasm. Some people really like it, with deep penetration when cervix moves. Most people hate it, but some people, when you get into it, because that kind of gets your vagus nerve, your parasympathetic nerve. So that is basically the vagus nerve, and that's a very deep stimulation. And same thing, same kind of orgasm can happen with deep throat. A lot of women say that, I get, and men say that I get, when a penis goes like super deep in my throat, it's just the vagus stimulation. I get that deep feeling. It's a completely different kind of orgasm, but I mean, the main one is really clitoral orgasm. Clitoris is a very, very powerful organ, and is outside and in, and it's almost as big as a penis, especially when it's engorged.
mm.
Mm.
I think it's quite interesting how, like, big penises are like, you have to have a big penis, but realistically, like, if the party's at the front, really, so you don't at all. So I just like, how did that get so blown out of proportion, really?
Because people see it, I tell you,
Yeah.
it's all about the angle. Just
Mm,
I would stimulate. Basically, I would tell people, somebody with a penis size of a pinky, if they use the right angle,
mm,
can
Mm.
stimulate a lot more than a penis that's, I don't know, size of a huge cucumber.
yeah.
So that angle is really important, and knowing the anatomy and everything. Of course, listen, what happens with a big penis, even when the angle is flat, you know, if the guy is even blind and doesn't know what he's doing, it is gonna stimulate, you know, everywhere. It's gonna stimulate the front wall anyways. But reality is that you don't really need that large penis to do
Mm,
that, because you can stimulate the front wall even with a small penis with the right angle. You just have to work a little harder and make sure
Mm.
you know what you're doing.
Great. Okay. Well, thank you so much for like all of the information that you've given us, and yeah, I hope this was like
yeah.
helpful to our listeners and they kind of have more of these conversations. As you were saying, it's so important to talk to as many people about it as possible.
Of course.
Where can people find you, find Saray?
Sure. So for Saray, it's Get Saray. So GET, just get CERE, getsaray.com. And the best place to find me, and even if you have questions, you can send me a direct message, is my Instagram, NYC, like New York City, NYC Gyno, GYNO. So NYC Gyno, you're more than welcome to send me a DM. Usually I get back within 2-3 days. And I reply to all the DMs myself.
Oh, wow.
Okay.
Yeah,
Amazing.
go find Dr. Marashi there.
Yeah. Thank you so much again for joining.
Thank you
Thank
so much.
Yeah. Thank you so much for having me. Thank you.
Yeah, of course. Okay, thank you so much to Dr. Amir Marashi for joining us.
In his scrubs and all.
Yeah, it was so genuinely so interesting. I learned a lot about, sex positions, the clitoris, all of this crazy stuff that we didn't know.
And that should just be for everyone to know, really. This is like what's gonna, as we talked about, gonna close the pleasure gap and like actually increase a lot of pleasure for women, and that's all we want, really.
Yeah, that's literally what we want, and to encourage having these conversations.
Yeah, so thank you so much for your knowledge, Dr. Marashi, and I hope you guys enjoyed. If you want to hear more from Dr. Marashi, you know where to find him, and if you want to hear more from us, then check Sextras Podcast on Facebook, TikTok, Instagram.
Join our Patreon, as
definitely.
we mentioned. You get all that extra bonus content. And you can also find us on our website, www.sextraspodcast.com. We have like all our episodes on there. We also have extra resources. We have links to everything you could need. And you can also email us sextraspodcast@gmail.com if you have anything to say, if you want to tell us about your experiences. We always want to hear about it. So definitely do that. And we will see you in our next episode.
Bye.
You've been listening to Sextras, presented by Honey Jane Wyatt and Maria Jose Hayodatiyi. Produced by Mabel Productions.